In the United States, as of 2020, more than 5,500 children and adolescents had kidney failure or end-stage kidney disease. These patients rely on life-saving dialysis or a kidney transplant.
The principal approach for Fresenius for dealing with pediatric patients is first to encourage transplantation. Secondly, it's to make sure that we have the appropriate staff training, we have the appropriate equipment, and we have the appropriate physical layout to accommodate children.
A lot of pediatrics in the United States are getting care in hospitals. Families are having to drive 5 hours, 4 hours one way to get treatment. So to be able to bring those children back home to their families and bringing them into our outpatient clinics provides a huge benefit to the families.
Pediatric nephrology is different from adult nephrology primarily because their needs are different, their emotional status is different, their disease state is different, and their way of coping with the diagnosis is very different. And so it's important to address all of these issues and understand how these things come together while we manage the care of these patients.
It can be anywhere from infants out of the NICU to our older teenage population.
Most of our patients actually are 13 years or older. But the challenges that population brings is different than a young baby who needs care from their parents at home.
If I have the magic wand, right, I would have an adolescent unit within the dialysis unit. I would have things that are age appropriate and appealing to them. As a parent of an adolescent on dialysis, the nurses and providers who made the difference were those who spoke directly to my child to give this adolescent the authority over their lives and their health care.
Fresenius Medical Care continues to advance its Pediatric Services Program, which is designed to impart specialized knowledge, skills, and technologies required to provide pediatric hemodialysis and peritoneal dialysis care. This program provides education and information for the clinical and technical aspects of caring for pediatric dialysis patients.
We wanted to make sure that we created a foundation, that all the clinics could create a plan individually for each of these patients that would give them the care that they needed.
Fresenius has done an excellent job in providing some of the infrastructure to allow you to take on these patients and not cause incredible difficulty within your unit or your practice.
I think the key thing with our pediatric population is all the care is individualized. We have to look at each child, we have to look at their social factors, we have to look at their history, we have to look at their comorbids. They have different feeding needs, they have different growth and development needs, and then we have to develop a package of care that really meets all of those needs where they are.
The approach to pediatric dialysis is one that we've really had to build from the ground up with a multidisciplinary team. So that includes external consultants, pediatric specialists, nurses, dietitians, social workers, all giving us input as to what goes into providing the best possible experience for our patients.
Our goal is to not only walk the clinic through from the referral to the admission to how do we care for that patient in the long term? How do we make sure that they over time get what they need?
Dialysis for pediatric patients is really a specialty unto itself, but Fresenius has spent quite a bit of effort and time over the last 3 years making sure that we're really able to take care of those pediatric patients. Equipment that we use for adults is not appropriate necessarily to use for children. The blood volume is different. The blood vessels are different. Secondly, there are physiological differences. With children, maintaining their metabolism and making sure that they're in an environment where they can grow normally is hugely important. And then thirdly, psychosocial factors. Those are always important to all of our patients, but they're particularly delicate with children.
In the U.S., Fresenius Medical Care has developed a program to help our clinicians care for the pediatric patient population. Training and education materials have been developed to help treat, manage, and support our youngest patients and their families.
We have a pediatric WordPress site. It houses a lot of information. We have LMS classes. We have resources. We have all the Kdoki resources linked. We have transportation forums, school forums, everything that you would need. That site is ever growing. We are always adding to it just to make sure that we have what we need.
There's educational modules that are there to assist both dialysis nurses, dialysis techs, dietitians, social workers. Really quite comprehensive. So there's teaching modules to cover the care from A to Z.
We want to make sure that we have a good way to get our staff educated on how to manage pediatric patients better. We're also making it easier for clinics to actually understand what they need to support a pediatric patient.
The benefit of the program is to provide support to not only the children, but to their families, and then also to our clinics to make sure that our clinics have what they need, and then in turn the patients get what they need.